Hi, I'm Lex Gillies, presenter of Skin Unfiltered and ambassador for the British Skin Foundation. I've spent half my life learning to love my skin, ever since being diagnosed with rosacea in 2005. We made this podcast to help you feel less alone. When your skin is sore, uncomfortable, or causing you problems, I know all too well that it can feel isolating and like you're the only person in the world with that skin issue. But we're all united by skin. A massive 60% of us will have a skin condition at some point in our lives, and we wanted to show that perfect skin is a myth, even to the people you see on your screens every day. In every episode, I'll be joined by a consultant dermatologist and I'll get under the skin of a famous face to discuss skin conditions that range from skin cancer to psoriasis. We'll talk about the highs, the lows, the treatments, the facts, answer your questions, and tackle some of the skincare trends that are circulating online. Here's what's coming up in this episode. Award-winning influencer, skin positivity activist, model, icon, Kadeeja Sel Khan.
I just don't realise how many people out there are insecure just like me. Oh my God, I can't believe I'm this close to them. Rita Ora, Cara Delevingne, it was surreal. When I first got a spot, I didn't really think anything of it. And then I remember it got on my chest, my back, my neck. It was really cystic. Couldn't even go to the corner shop without a full face. You couldn't even tell it was me. I just didn't like anything about myself at that moment.
What are some of the treatments for acne? What do you suggest to your patients who come to you with scarring? Is it possible to have smooth skin without spending thousands?
It's not something that I would recommend. I think let's leave lemon juice and bacon soda for cakes in Korean skincare. Certainly there's some evidence for that. There's a lot of talk about natural skincare when actually...
Hello and welcome to Skin Unfiltered. Today we're talking acne with Kadeeja Sel Khan, maybe the most apt guest we could find for a podcast called Skin Unfiltered. Kadeeja is an award-winning influencer, model, and skin positivity activist who has redefined beauty standards by sharing unfiltered skin content for almost 10 years. Her honesty has landed her features in Vogue and Elle and campaigns for brands like Rimmel London and Makeup Revolution. I can't wait to meet her, but first let me introduce this week's dermatologist, Dr. Derrick Phillips. Hello.
Hello, thank you for having me.
Thank you so much for being here. You've been in medicine for almost 15 years and you've won awards for your contributions to dermatology. But where did your interest in skin come from?
Well, I must admit, I didn't want to be a dermatologist when I left medical school, but I had a really inspirational rotation as a junior doctor, and it opened my eyes to sort of the breadth of the specialty and the profound impact that you can have on patients with skin disease. So yeah, that's what really sort of sparked the interest in dermatology all those years ago.
So it was never in the original plan, but it all worked out.
It wasn't. No. I actually wanted to be a neurosurgeon.
Oh, wow.
Very different.
And how did you get involved with the British Skin Foundation?
So as a trainee dermatologist, I was very much aware of the British Skin Foundation because they sponsor a lot of the research that sort of I saw coming through, and also some that I was involved in. So yeah, when the opportunity came for me to work with them, I jumped at it.
Let's talk about today's guest, Kadeeja Sel Khan. What do you know about her?
So I've seen Kadeeja on social media, and in a world of filters and Photoshop, it's really refreshing to see someone really portray her authentic self online.
I think it's so needed as well. I think there's so much kind of fake skin out there that it's really lovely to see natural skin.
Yeah.
Kadeeja has been really open about her acne journey, and you specialise in adult female acne, so I imagine she'll be really pleased to get to talk to you. Most of us think we know acne, but what can you tell us about it?
So I think the first thing to say is that, acne isn't something that just affects teenagers. So it affects people at different stages in their life. So there's infantile acne, there's teenage acne, there's adult female acne, and there's also sort of menopausal acne as well. So acne can affect people at lots of different stages. It's a condition that affects the hair follicles, the oil producing glands, and the pores, which are collectively known as the pilosebaceous unit. And essentially you get increased oil production, a buildup of scale inside the pores, and colonization of the pores by a bacteria called Cutibacterium acnes. And these three processes drive the development of blackheads, whiteheads, pimples, nodules, and cysts, irrespective of which stage in your life you're experiencing it.
Okay. I'm really excited for this one. Should we get her in?
Yeah.
Welcome, Kadeeja. Thank you so much for being here.
Thank you for having me.
We're going to break the ice with some skin deep questions. What is the silliest thing you've ever done to your skin?
I would say putting toothpaste on, and thinking that would work. Putting a lot of rice on my skin because I heard online that works as well. And I think the worst one out of them all is lemon and baking soda. Yeah, I don't know what I was. Yeah, I don't know. I just thought that was gonna work.
Did it sting?
Yes,
Oh my
I had
gosh.
a really horrible rash after.
We'll have to ask Dr. Derek about some of those later. But on to the next one. Do you think you've learnt to love the skin you're in?
Yeah, I mean, I'm 29 now, so it's taken a really long time. I wish it happened a lot sooner, but now I can definitely say that. Yeah.
What do you love most about your skin?
I love the most that apparently if you have oilier skin, you age better. I didn't know that before, but I checked it out. I don't know if it's true or not. But apparently that is. And, obviously I do have scarring on it now, but I don't know, it just reminds me of a time where I really didn't like my face. So I'm just like, I'm really grateful. Yeah.
That's lovely. It's time to go a little bit deeper. Many people know you from Instagram and TikTok. You have almost 500,000 followers, but it really took off when you started sharing your unedited content and opening up about your acne journey. Can you tell me about your experience of acne?
I would say that when I first got a spot, I didn't really think anything of it. I didn't actually care. I was just like, oh, it's fine, whatever. I've got my first breakout. For some reason, it looked kind of exciting. I was like, oh, okay, I'm becoming a teenager. And then it started to get really bad. And then I remember it got on my chest, my neck, my back, and I was just like, oh, I was like, what the hell is this? And then when I, went to the doctors, they were just like, oh, you've got acne prone skin. I was like, all right, what the hell is that? I have no idea. And yeah, it just started from there. So yeah,
How old were you when your skin issues started?
about 11.
Okay. And were any of your friends kind of experiencing similar things at a similar time?
Do you know what? They actually weren't. And then I think when I got my first spot, I was expecting other people to get theirs. I was just like, okay, it's gonna happen to all of us, but it didn't.
Tell me about a time you felt most unhappy in your skin.
When it was very cystic. Yeah, it was really cystic, and I think I gained a lot of weight at the time as well. So I just didn't like anything about myself at that moment. So
So, Kadeeja, how did you deal with your acne when you were a teenager?
I think that, I don't even know what medication they gave me. I began with an L. I don't know what it was called. I don't know. I can't remember. I don't want to say a wrong name.
Limecycline.
Yeah, that. So they gave me that, and it was like a 3 month and then 6 month. I thought my skin was getting better, and it obviously wasn't. So I went back, and then they would give me like, I don't know, like a face wash and all that stuff. Basically nothing helped, and I was just like, oh my God, like what the hell? So then I turned to makeup. I'd literally cake my face. Like it was so embarrassing. Like even when I look at it now, I'm like, oh my God, what the hell? Why did you do that much? But I thought that would help just until the acne would go, and it literally didn't do anything. It just looked a lot worse.
Did it give you confidence in the moment, though, when you were covering it with makeup?
Do you know what? I thought it would. And then when you go to school, people will be like, what's wrong with your face? And I'm like, oh, like, what's the point of even buying it? Like, it's so silly.
Yeah. So you
Yeah.
kind of felt like you couldn't win because I
Yeah.
imagine people would say things if you didn't go with makeup on as well.
Yeah. I mean, if I didn't go with makeup on, I'd have like a really red face. And then if I did wear makeup, it's like, oh my God, like your skin looks like, they would say all these mean words. But I'm just like, all right, well, what on earth do I do with my skin? And I just felt like, yeah, nothing that I got from the doctors was helping much.
But what point was it that you felt that it was time to see a professional? Do you remember?
I think all throughout my teen years, I didn't see a dermatologist or anything like that. I just went to the doctors because that's the only thing you know at that age. I think just, doctors, you don't really know about a dermatologist. And then obviously nothing was happening. My skin was still really bad. And I think at that point when I turned like, I don't know, even 19, 20, I just thought, okay, like this is my skin, nothing I can do about it.
I hear from a lot of people who they're worried about bothering their GP, especially if it's something quite common like acne. Is that something that you were concerned about when you were younger?
Do you know what? No, because I thought like I really need help here, and that's what you're here for, kind of thing. And I feel like they were really helpful as well. Like they were just like trying to find a solution out. So obviously, if something wasn't working, I didn't really feel like it was a bad thing for me to say, is there something else? But I think that it comes to a point where you think, oh, nothing is just going to help my skin. Like, whatever, I just have to stick with it.
Dr. Derrick, is that something that you see with people where they feel like they can't go to their doctors with something?
Yeah, I think there is a perception among some people that acne isn't a medical problem and it's just a minor condition, and they feel that perhaps they should reserve appointments with their GP for more serious things. But acne is actually, a serious medical condition that can lead to scarring if you don't manage it appropriately. So you should never be ashamed to contact your doctor, because ultimately we're here to help people. So yeah, it is something I'm aware of.
Yeah. And I think if something is impacting your day-to-day life, whether that's your physical health or whether it's your mental well-being, that is something that you should be talking to a doctor about.
No, most certainly.
What are some of the treatments for acne?
So there are a broad range of treatments, and it's probably best to divide them into sort of the things that you put into your skin, so the topical treatments, and then the tablet treatments, and then also the sort of newer treatments, which we call sort of energy-based treatments like lasers. So in terms of topical treatment, so we have antibiotics, which work by reducing inflammation in the skin and also reducing the levels of the bacteria, Cutibacterium acne, which drive acne. And then you have the topical retinoids. So retinoids are things like retinol, tretinoin, differin. And what they really do is that they help to unblock the pores by reversing the buildup of scale inside. They reduce inflammation and make the overall environment inside the pores less hospitable for the bacteria. But retinoids do take a while to work. So you do need patience with these medications. It can take sort of, 8 to 12 weeks to see the maximal impact. And then there are combinations of those two medications, so antibiotics and retinoids. There are sort of topical anti-inflammatory creams, so like azelaic acid, niacinamide, and what they do is reduce inflammation. And by inflammation, I'm talking about sort of the redness and the soreness that people can experience when they have pimples. Going on to the tablet treatment, so for really severe nodular cystic or even acne, where you have the red bumps and the pus-filled spots, which we call papulopustular, oral antibiotics can be helpful. And that's because they reduce the burden of the bacteria in the pores and also suppress inflammation. And if you combine the antibiotics with some of the topical treatments, particularly things like benzoyl peroxide, it can actually prevent the bacteria from becoming resistant to the antibiotics. So there's a synergy there between those treatments. And then for more severe forms of acne, we often consider isotretinoin, also known as Roaccutane or Accutane, which is a form of vitamin A and remains the gold standard treatment for very severe forms of acne. And then sort of bringing you into the 21st century, we have some newer treatments, which are sort of laser or energy-based treatments. So things like Aviclear, or also pulse dye lasers, which can use energy and laser light to reduce the inflammation in the pores and also tackle the bacteria that cause acne, as well as in the case of Aviclear, also reducing the number of oil-producing glands you have.
Okay. We mentioned the risk of scarring earlier. Sometimes that can't be helped. So what do you suggest to your patients who come to you with scarring?
Yeah, I mean, so scarring can't be helped in some instances. But if you do have scarring, then I often advise patients on things that they can do to prevent developing new scars. So such as, making sure that, if there is any residual acne, that we really get on top of it with appropriate treatment. And also things such as, advising them to avoid picking, because we know that picking and scratching significantly increases the risk of developing scars. And then depending on the type of scars that you have, and there are different treatments available that can potentially help and reduce their appearance.
Kadeeja, you've been very open about your scarring. Have you struggled to love the way that your scars look?
I forget that I have it now. So I feel like someone that is looking for a skincare product, they will remind me, they're like, oh, like I've got, you can see my skin is the same as yours. What do you suggest? I'm like, oh my God. I'm like, oh, I suggest this. And I try not to get offended because obviously it is my skin and I know they're not saying it in a bad way, but I'm just like, so stuff like that reminds me, and I'm just like, okay, it's like, I guess it's really apparent, like, even though I sometimes forget it. Yeah.
You've spoken openly about being diagnosed with polycystic ovary syndrome. Is that something that came off the back of your acne diagnosis?
Yeah. So I feel like I didn't know about the PCOS for a while. And it was mainly when my obviously monthly cycle would not come. And I literally, I don't know why, I just thought it's not something you would talk about in general. So I thought it was normal. And I was just like, oh, a couple of months ago past, like it's normal, whatever. And then I don't know, I think one of my friends would bring it up and stuff like that about their monthly one. I'm like, yours comes every month. Like, don't you want to go to a doctor? And they're like, no, it's supposed to come every month. I was like, oh my God. So then yeah, I'd go to a doctor, I'd find out that, and then it would make a lot of sense because I'd lose a lot of hair on my head. Like I have like bald patches, and I'm like, okay, where's that coming from? You know, I'm really young. I can't be losing my hair like that, like straight away. And then I gained weight, and it was just so many different things. And then I remember going to a doctor and they suggested go on the pill. I was like, I don't want to go on that.
So you didn't, when you were looking into kind of the symptoms that were going along with your polycystic ovary syndrome, you didn't kind of connect it.
I always seen it as something separate because my skin was just so over the top. So I always seen them as two separate things.
Okay. Dr. Derrick, is there a link between PCOS and acne?
Yeah, there's quite a strong link. So PCOS is a condition whereby there's an increased amount of particular hormones which are known as androgens. And one of the effects that the androgens can have is that they can increase oil production from the sebaceous glands, and they can also increase the buildup of scale inside the pores, which lead to acne. As well as sort of leading to other things such as some types of hair loss, such as female pattern hair loss, and having irregular cycles. So having polycystic ovary syndrome is a risk factor for having acne. And actually, sort of when we treat polycystic ovary syndrome, that can lead to an improvement in acne as well.
So this kind of harks back to what we were saying earlier about going to the doctor about your acne. There may be sort of other conditions that go alongside it, which a doctor would be able to advise on.
Exactly. Sometimes when you're sort of the person living that particular experience, it's difficult for you to join the dots. And you may be thinking that these are all separate things, but that's why it's good to always divulge all these informations to your doctor, because there may be a wider pattern that, that they can put together and make a diagnosis and provide a more holistic treatment.
And are there any other conditions that kind of go alongside acne in the way that PCOS does?
Yeah, I mean, so there are other conditions that can be associated with increased level of androgens. Some of them are less common. And also some medications can also cause acne as well. So for instance, people who might be on long-term steroid medications for particular conditions that can affect the skin and increase the risk of acne.
Okay, thank you. Kadeeja, take me back to that first Unfiltered post. What made you upload it?
So it's funny because a lot of people are like, did you plan that? I was like, no, I actually didn't. So I would heavily edit my images. Like you couldn't even tell it was me. It was so embarrassing. Now I think about it, I'm like, what are you thinking? So I'd heavily edit them. I'd spend so much time doing it. And I think one day I was just, I can't be bothered to just spend all this time. I just want to upload something. So then I remember I did a video and I uploaded it. And yeah, that literally went from there.
Do you remember how many followers you had at that time?
I think I had about 7,000. And then when I uploaded like all the unfiltered stuff, I got a lot of hate for it. So then I went back to filtering it because I got really scared. I was like, oh my God, I can't deal with this. I'm not built for this. But then I was like, can't be scared of people now. Like, I just have to do this. So then I think like a week later, I carried on and then I deleted all my posts with all the filters and all that. So then, yeah, it grew after that.
So has the way that people have responded to your content changed since you've changed that? And has the type of person that follows you changed, do you think?
Yeah, I would say before it was mainly people that wanted like makeup advice and just I don't know that just makeup tips and stuff. And then when I did that, I feel like a lot of people were like, oh my God, like I've got the same skin as you. And then it was nice for me as well because I was just like, okay, now I know I'm not alone, kind of thing. Because before that, you feel like the ugly duckling out of all of it. You're like, okay, let me just post this, so like at least I can have people that are like me.
So with so many followers, do you ever meet any of your followers? Do they ever stop you in the street?
Yeah, I mean, when I meet people that follow me, it is really sweet. They're like, oh my God, you've helped me. And I don't know, it's weird because maybe sometimes I forget and I just don't realize how many people out there that are like insecure just like me. and it's helped. So whenever I get that, I'm just like, oh, that's so nice.
It must be nice because obviously you're kind of behind a screen and you're putting things out, but it must be really nice to see that
Yeah.
that reaction in person.
No, it definitely is. And just knowing that you can help someone is just, yeah, it's really lovely.
You're doing something so important by opening up about your issues with your skin. You mentioned there that you did get some kind of trolling, some mean comments from people. Can you tell us a little bit more about that?
Yeah. Oh my God. It was just the nastiest thing ever. Like, how is she a role model? Like, she's like, she looks like this, and you don't wash your face. You can't even believe that people write certain things. So I was just like, oh my God, all right. I feel a ton times better now.
How do you deal with it in the moment when you read stuff like that?
Oh, I was really upset. I was just like, oh my God, this is like, why am I even bothering doing this? Like, it just makes me feel a lot worse. But then, people are always gonna, like, even if you look great and perfect, they're gonna say something. So I was just like, it's fine.
Dr. Derrick, there are some prevalent myths around hygiene and acne, aren't there?
Yeah, yeah. I mean, so yeah, one of the commonest myths that we should definitely dispel here right now actually is that acne is caused by a lack of cleanliness. It's not. Acne is a complex inflammatory skin condition which is caused by an interplay of genetics and hormonal changes and environmental factors, and it's got nothing to do with cleanliness.
Thank you so much for saying that so clearly. I feel like we need
Yeah,
that
because
to be
everyone says the
said.
opposite.
Kadeeja, despite the negatives,
Mhm.
some incredible opportunities have come your way, and you've worked with some huge brands. Is there a campaign that you're especially proud of?
I would say the Rimmel London campaign. That was something that I was really proud of because I got to meet, Rita Ora, Cara Delevingne, and it was surreal. So I'm really proud of that one. And it was something around real skin, and it was something that was really, really realistic because I know a lot of brands are doing it now, but I remember when it was like the earlier time, it was something that came out. And I was like, that's really amazing that someone as big as Rimmel are doing unfiltered skin.
I remember seeing it, and I remember the reaction online was
Yeah.
really positive that they were doing something so real. How was it meeting Rita Ora and Cara Delevingne?
I think I forgot how to speak at one point. I was just so like, oh my God. I was like, I can't believe I'm this close to them. Like, it was just so weird, but they were so lovely. But I just felt like, yeah, it was scary.
Have you experienced any negative situations in the beauty industry?
I would say one situation was, well, I was really excited before any of this even happened. So I was obviously approached and everything to work on a campaign was really lovely. And I think when I went into stores, because this campaign was going to be in stores, and in the shop windows, my face was photoshopped. And it was so embarrassing because I feel like even the workers didn't know that was me. Yeah, that was just, I would say that was the worst.
And like, did any of your followers like notice? Did they say anything?
Yeah, they did. They were just like, what is this about? You're all about unfiltered. Like, what is this? And they were really disappointed. I was just like, it's more embarrassing if I say I didn't know, because I'm just like, clearly I would have known kind of thing, but
Yeah.
I genuinely didn't. So
Oh
that
my
was
gosh.
embarrassing.
Do you think you'd ever put something in your kind of contracts going forward to say like, don't Photoshop me?
Yeah, I mean, like that's the whole thing of, I would say, what I'm about is no Photoshop. So I assumed that would be the case
Yeah.
anyway, but when it wasn't, I was like, oh my goodness. So
Yeah, you
yeah.
would think that they would like, because they chose you for that campaign, they were
Yeah.
choosing you for like the positive message about
Yeah.
real skin.
Yeah, I know. It was definitely embarrassing. So yeah.
Dr. Derrick, do you think there should be kind of industry standards about editing or kind of disclaimers on ads to say like this has been changed, that's been changed? Like, what are your thoughts on that?
I think certainly that would be helpful because there are lots of sort of young people who consume social media and do not appreciate that what they're seeing isn't a true likeness of the person. And that only just perpetuates, these insecurities and, makes people less willing to show their true self and true skin. So I think that it would certainly help.
Do you ever get people coming into your clinic and saying, I want to look like this person, I want to look like this photo, and it's, something that from your eyes you think that's not real skin anyway?
Yeah, I mean, so I for all my patients, so I inform them that there's no such thing as perfect skin, and and it's some of it's the imperfections in skin which keep us human. Perfect skin is a unobtainable ideal, and I think it's it's good for everyone's mental health to appreciate and to acknowledge that.
Absolutely. Kadeeja, do you ever feel the temptation to edit your photos even now?
No.
That's
No.
great.
No, I don't even think about it. It's just like, okay, you've already seen me. This is fine.
That's wonderful. What do you think that keeps you kind of showing up as you are online?
I think that it's something that I've worked hard to be comfortable in. So I don't know why I would give myself the reason to go backwards, if that makes any sense. Because it takes a lot to become comfortable with how you look without, especially when your life is consumed around filters. So to let it go, it's just, yeah, it's a nice feeling.
Yeah. How do you think the landscape has changed since you first started posting your bare skin?
I would say that it was, I'm sure you can relate to it. There was not that many people doing it. And I feel like now there's so many people, but it's nice the fact that it's becoming normal. Do you know what I mean? So now we don't have to like go all the way to the bottom of Instagram to find someone that looks like us or that like has a skin, dilemma or anything like that. Now we can just see it out there, if that makes any sense. So it's so much more different.
Yeah. I think there's just like this whole community that's built
Yeah.
up around kind of being honest and just being comfortable in your own skin.
100%.
Do you think there's a difference in the way that skin is presented in like traditional media and social media?
I would say social media is a lot more different. I feel like normal media, like magazines and stuff like that, and TV and all that, it's catching up, but I don't think it's there.
Yeah, I think now like you see in magazines and things, and the only time you really see real skin is when they're talking about like a skin condition.
Yeah, yeah. And I think that they should make it more like when they do their covers, like maybe they don't even have to point it out that, oh, this person's got a skin, condition. I think it should just be normal now to just have normal skin.
Yeah, I agree. You started out as a makeup artist. Do you use makeup now when you're having an acne flare up, or how do you deal with acne flare ups these days?
Do you know what? If I'm having an acne flare up, I don't really use makeup. I think before I'd use so much, like I'd bathe my skin in makeup the way you would do an SPF or anything like that. But now it's just like, oh, it's all right. I can not have makeup on. It's cool.
So do you think now it's kind of like makeup is something you do? It's like it's not bringing your skin into it. It's like a separate kind of hobby.
Yeah, now it is. I think before I couldn't even go to the corner shop without a full face of makeup. It's like, now think about it now, I'm like, oh my God, that's so bad. But if I have anything, going on with my skin, I don't mind going makeup free.
That's incredible. That's like when you think about how much your mindset has changed.
Yeah.
That's really incredible. Kadeeja, thinking about where you are now, what would you say to younger Kadeeja when she first started experiencing her skin challenges?
Like just don't be so hard on yourself, because I think that the way that you speak to yourself is so important. I think I would take it upon myself to be like, oh, like you are ugly, like, oh my God, why is your face like this? You know what I mean? And that would impact you a lot in the future. So just don't do it.
Yeah. I think it's so hard, and it's something that is hard to explain to people who haven't had that experience, how much of an impact it has on you and how that impact can kind of follow you through life as well.
Yeah.
So I think that's a really lovely message. You have been featured in Vogue.
Yeah.
What do you think your teenage self would say if you went back and told her that?
I don't know, because it's just, yeah, it was surreal. Because I was actually featured, I think there were 4 times, because in Germany as well. So I don't think I'd even believe that. Oh my God, really me? Okay, that's fine. Yeah, I don't know. Surreal.
Kadeeja, as we have your lived experience and Dr. Derrick's medical experience, we have asked our listeners to send us some questions and requests for help. Would you guys be happy to help me answer some of these questions?
Yeah.
Thank you. Okay. I never know what to say when people make comments about my skin. Help. So do people ever say anything to you in real life, and how do you react to that?
To be honest, when someone says something and it's a little bit negative, I'm just like, I don't even say anything. I'm just like, what can I say back to that? But it's all right. Just let it brush under the carpet. It's fine. As long as you feel good about yourself, just don't listen to it.
I think that's really good advice. I think it's like, what's the saying where if you wouldn't go to them for advice, then don't take criticism from them. I think
That's a good one, actually. I need to write that down.
Okay, next question. I have really bad acne and I treat it with retinol, but I keep reading that it thins the skin and I'm worried I should stop using it. Dr. Derrick, what do you have to say?
Well, I think the misunderstanding there comes from the fact that retinol increases the skin turnover. So it exfoliates, so it removes the dead cells in the top of the skin, and it shortens the transit from the cells from the bottom of the skin to move to the top. It doesn't actually thin the skin because it also can boost collagen production in the middle of the skin. So there's no danger of you thinning your skin out by using retinol.
Okay. You can kind of see where the myth started,
yeah.
like people just kind of misunderstanding, but it's good that you've cleared that up for us. Okay, next question. Even when I'm not breaking out, I have bumps and scars. Is it possible to have smooth skin again without spending thousands?
Yes, and I think the important thing is to see a consultant dermatologist or your GP, and for someone to really assess your acne and come up with together you can work together to come up with a bespoke treatment plan, because we need to identify what those bumps are. So if the bumps are, white heads and black heads, then it might be that you need more exfoliative treatments. But if they're sort of more what we call inflammatory acne, then it may be that you need another type of treatment. And there are a range of treatments that can be suitable for all budgets.
Thank you. Kadeeja, from your experience, what advice would you give someone that is worried about bumps and scars?
I don't know. I would say, I know this sounds a bit silly, but just look at what you're putting on your skin sometimes. I don't know. I'm not a dermatologist. I get scared to answer this, but I don't know. Because sometimes I've used a skincare product or makeup product, something that is just doesn't gel well with my skin, and maybe I just don't know it.
I think that's a really interesting point and important point that you raised, that you do need to have an understanding on your skin type and just like how your skin behaves and reacts to things. Because it might be that you're someone who has quite oily, blemish prone skin, and you're using a lot of oils, cleansing oils, and other types of oils which are just aggravating the acne, but you don't know any better. So it's certainly a good idea to see a dermatologist. I'm not just plugging somebody.
A more general question now. I want to stop using filters, but I just can't do it. Any tips?
Think of it as catfishing, kind of. Like, just imagine you're gonna meet someone or whatever. Like I've had people that make comments to my skin when I used to Photoshop it heavily. Like, I would have people that I'd work with and they'll be like, oh, I didn't even know that was you online. So I feel like just have it in your head to feel comfortable with your skin, and who are you even impressing?
Yeah, I often wonder, it's like, when you see people underneath saying like, oh my God, your skin's so beautiful. And it's like, it's not even a compliment. It's not even a real compliment because it's like, it's not based on anything real.
Exactly. And I think that would make you feel a lot worse if someone's like, oh my God, I want skin like yours. You're like, my skin's not even like this.
Okay, the next question. Somebody after your own heart, Kadeeja. My mum says that putting toothpaste on spots helps with acne. Does it?
No.
That's the shortest answer there. But it's one that's been doing the round since I was a teenager. So it's not something new. It's something that's been passed on from generation to generation.
I think when I was a teenager, I heard that it dried the spot out.
I heard that as well. Like, it dries it out, and when you wipe it off, your spot comes off. No, it doesn't. No.
Is toothpaste, is it going to do any damage, or is it just kind of like it's pointless?
I mean, it's going to cause irritation. If you have an inflamed spot, then the skin barrier is already slightly impaired. So it's probably not going to help, and it possibly could make things worse. So on both fronts, I'd say no.
Okay. It's a no to toothpaste. No. So while we're talking about some kind of dubious skin myths, you mentioned earlier about putting lemon on your skin. So what was that? So
this is where it came from. I Googled it, and you know the way you see all these websites and all that, and I did see it saying, baking soda, lemon, all of that jazz, and you make your own mask. And I was really curious about that stuff at the time. And now that I think about it, that was just the worst thing ever. Because I remember when I put it on my skin, it was, oh my God, my skin was so itchy after. But I thought, oh, it's doing great. Like, it's cancelling out the pimples. Yeah, it wasn't.
I think let's leave lemon juice and baking soda for cakes. Not the skin.
Yeah.
Yeah, I mean, look, so citrus fruits, contain vitamin C, but not in a form that your skin's going to be able to use. It's going to cause irritation, and bicarbonate of soda is alkaline, so it's possibly going to irritate the skin further. So, not a good combination. As I said, probably best to leave it for bacon.
Sadly, we're almost at the end, but there is just enough time to get a dermatologist's take on the many, many wild skin theories that are out there online. Dr. Derrick, you must get fed up of all the misinformation around online.
There is a lot of misinformation online, and as dermatologists, I feel like we can't put out rebuttals quick enough. Yeah, so it can be a bit exhausting. When we put the scientific rebuttal or the information out there, it doesn't always get as much traction. It gets sort of buried. It's difficult, and I wish that sort of there would be more in the way of fact checking for some platforms, because I think that would make our jobs a lot easier.
Definitely. Kadeeja, this is your chance to find out from a professional if a viral trend you've seen is brilliant or nonsense. Is there anything that you would like to ask Dr. Derrick?
There's one I've seen, obviously the toothpaste one we've covered. It's when you put like rice in water, you let it soak for a bit, and then you put like cotton pads in there and put it on the face.
Yeah, I mean, I've seen lots of Korean skincare brands using rice water toners, and certainly there's some evidence for that. But those products have been carefully formulated and tested, and probably are more efficacious than your bog standard rice and water that you have at home. So it's not something that I would recommend.
Yeah.
And Dr. Derrick, is there something that you've seen online that you would like to debunk once and for all?
Yeah, I think there's a lot of talk about natural or clean skincare, and it seems to have been elevated to the gold standard. When actually, these terms are meaningless in the sense that they're not sort of regulated, or there's no fixed definition. And often, you can still get irritation from them. There's still a risk of developing allergies if particular constituents are at high concentrations. So there are still problems associated with them. So I've seen a lot on social media regarding beef tallow, people using it as a moisturizer. I mean, the first thing that comes to my mind is why, when there are so many elegantly formulated cosmetic products out there that can moisturize and hydrate the skin, rather than going for, a product that's derived from beef lard. And secondly, it's very oily, and it means that, if you're someone who has blemish prone skin, it can potentially break you out. So it's not something that I see the need for.
I also imagine that it doesn't smell great.
No.
Thank you so much, both of you, for helping me to debunk those myths. And that's it. We did it.
Yeah.
Thank you both, consultant dermatologist Dr. Derrick Phillips and influencer and icon Kadeeja Sel Khan. Thank you so much for being here.
Thank you for having me.
I hope you enjoyed that chat. I'm so thrilled to be working with the British Skin Foundation on the Skin Unfiltered podcast. When I was first diagnosed with rosacea, I felt so lost and really struggled to find trustworthy information about my condition. I hope that by listening to this podcast, you not only feel more educated and informed, but also less alone. If you enjoyed this episode, please subscribe wherever you get your podcasts, or you can also like and subscribe on YouTube. Don't forget to follow the British Skin Foundation on all the usual social platforms for the latest research and skin information you can trust. Just search @BSF Charity. Skin Unfiltered is a British Skin Foundation podcast presented by me, Lex Gillies. Produced and edited by Scott Jenkins, commissioned by Bickerstaffe at the British Skin Foundation, with production assistance from Tejal, Depala.